I'm David Mason, the Director of Public Health for the town of Sandwich, and we're doing a presentation today with Dr. Ryan Bemis and Joanne Gake, registered nurse, who are both residents of town and are working with our COVID team. They're going to speak to the COVID vaccine. Now, I want you to keep in mind, in history, we've had vaccines developed that have helped humanity, smallpox, polio, and that have eradicated some diseases. And at this time, we have COVID-19 in front of us and a vaccine developed, and we understand there's concerns about that vaccine. And Dr. Bemis and Joanne are going to speak to those issues and their experiences. So I think you want to hear about their experiences since they've both received the vaccination. So please watch. Thank you.
Yes, I'm Joanne Gake, the Sandwich Public Health Nurse.
Hi there, and I'm Ryan Bemis, an emergency physician over at Falmouth Hospital. I'm also the town physician for Sandwich and a member of the COVID command team here.
Right, and both Dr. Bemis and myself have received RNA vaccines. He's received the Pfizer vaccine, and I received the Moderna vaccine.
So these mRNA vaccines, I know, it's important for everyone to kind of understand what these vaccines are, just kind of the basics of what, how long these vaccines have been around, the safety of these vaccines, and the effectiveness of these vaccines. So I just wanted to talk to that. What is an mRNA vaccine? Now, these vaccines, the science of these vaccines has been around for decades, actually. They were developed, they were determined to be safe, and they were sitting on the shelves just waiting for an application. And then, unfortunately, along came COVID-19. And within the first couple of weeks of this virus, we were able to determine the whole genetic sequence of this virus. And we focused on the scientists focused on the spike protein and the specific messenger RNA sequence of that spike protein. And so we're utilizing that, or the scientists are utilizing that in the vaccine, basically taking this code and encompassing it with a lipid, kind of this lipid capsule to protect it. And that's what the vaccine is. So the vaccine basically will, this lipid layer allows it to get into the cells, and that was the main problem with these vaccines when they were first developed, is how to make our immune system not destroy them before the mRNA was able to be utilized by our cells to make the protein. So this lipid layer protects it, allows it to get into our cells. It doesn't get into the nucleus of the cell, doesn't affect DNA. It just utilizes the cell's ability to make proteins, and the cell will make spike proteins, which will actually form on the surface of the cell, allow our bodies to form antibodies to fight this, to destroy these spike proteins. And the great thing about these mRNA vaccines are actually you get more of an immune response than other vaccines. And interestingly enough, you actually get about 5 to 20 times an immune response compared to if you actually had the virus. And so with the 2 shots, you'll actually not just have antibodies that are fighting this spike protein attacking it, but you also have these natural killer cells which elicit more of an immune response if you were if you happen to be exposed to the virus after getting this vaccine. Now there are questions, so that's basically what an mRNA vaccine is, and lots of people I know have questions in regards to the safety of these vaccines and the efficacy. Now, as Joanne was saying, both she and I received these vaccines, and the vaccines are very safe.
We're here to talk about it.
Yes, yes.
We both survived it. My way of getting the vaccine is I joined the Moderna study, and how that came about was the year's been a bad year, and it was really frustrating, very tiring, and I knew I needed to do something that was positive. So I was reading the journals and the epi-blogs, and there was one article that came up saying, if you are interested in joining one of these studies, then you can submit an application. Because I had been reading about, especially the Moderna vaccine, I thought, well, this is a good thing to do. And I filled out the form and sent it in, and I heard nothing for a couple of months. So I thought, well, they probably have the numbers they need because they needed like 30,000 people. But then I got a phone call from the Brigham, the infectious disease part of the research, and they asked me if I wanted to be part of the study. I said I did, and they went through a 22-page informed consent with me over the phone, so I was semi-paying attention. And then they asked me to come in for a physical, for blood work, for PCR, which I did. And then they said to me, you can have the vaccine now, a vaccine now. So the question was, it would either be normal saline or it would be the Moderna vaccine. The problem I had deciding not that the vaccine was dangerous or a problem, my problem was, what if I got the saline? And I was stuck for 2 years, maybe if they didn't unblind the study, getting the saline, and I knew I'd be in the first tier of people getting the real vaccine. But, I figured I'd take my chance, and I did. And I got, hopefully, what I believe is the vaccine. But maybe I'll let you talk about the Pfizer, then we can talk about side effects.
Sure, and it's great that you did get it, because I didn't even think about that if you get the placebo and weren't able to have the vaccine for 2 years, because I know that everyone that I talk to wants to get this vaccine. I know there are people that are questioning getting the vaccine, but I think that understanding this vaccine, understanding the science behind it, and really just understanding COVID-19. I'll go through quickly here the risks of the vaccine, which are very minimal, but the risks of COVID-19 are significant. You could just get a mild illness, or you can end up in the ICU, or long-term effects. People are chronically, and I'm seeing this in the emergency department, coming in with chronic fatigue and shortness of breath. So the risks of getting COVID-19 are significant. But this vaccine is safe. As Joanne mentioned, I received the Pfizer vaccine since I'm a frontline worker in the emergency department at Falmouth Hospital. I received the first dose 3 weeks ago. I actually received the second dose yesterday. I have a little bit of soreness in my arm, but that's about it. I know some people, so let's just talk about the safety. What are the risks of getting the vaccine? It's essentially just two things. You can get a localized reaction where you have soreness, like most people will have after any vaccine. But I found that because there's a little bit more of an immune response to getting this vaccine, which is great because that's what we want, some people actually experience a fever, body aches, and that can go on for 1, 2, 3 days sometimes. And so I'm not experiencing that. I know that others have experienced a low-grade fever after the first dose, and there's more of a chance of it after the second. But those are the main side effects. There's nothing that's been shown in the studies that have been done on these two viruses, the Pfizer and Moderna study, to show that there's any significant side effects or complications from getting the vaccine. You received the Moderna, both of them. Did you, or you were in the study, but you feel like you did receive the vaccine, correct?
If I didn't receive the vaccine, I do have a major problem with my immune system. Because if you receive normal saline, you don't have a reaction. The first shot that I received, within a couple of hours, my arm was also sore. Not a big deal at all. And I had driven from Boston, so it was like 2 hours coming home. By the time I got home, the shoulder joints and my hip joints were sore. But, it could be the drive. That's what you always think. And so I was fine. The second vaccine, I was at Brigham and Women's, and they do observe you for 30 minutes after that. And they told me to make sure I had Tylenol and ibuprofen ready, which I did. And by the time I got home that afternoon, my arm was very sore. As sore as the shingles vaccine, in that I could barely raise it up. But you know what? It wasn't a problem. I just didn't raise my arm. And so I was fine. So as part of the study, you have an app that you have to answer questions on every night. You have to take your temperature every night. And I took my temperature, and it was 100.8. So I thought, well, I'm reacting to something. But And then I started with a mild headache in the back of my head, and muscle aches, but not severe. But the fever kept on getting worse, and so I didn't sleep the night. Now, mind you, I was really happy because that was not normal
Yeah, no,
saline.
that's definitely the effects of getting the vaccine.
So I thought, well, this is a good thing. But the next day, I had no appetite at all, not a big deal, but extreme fatigue. So that with the fever and the fatigue, I could barely get out of bed, which was fine. But by that night, I felt much better. It was like
So
all of a sudden.
It's a quick reaction, and your body's making the
Yes.
eliciting the immune response. We need that to get these antibodies and natural killer cells, and
Right.
it's not much to go through to be protected against this virus.
For sure, for sure. And because I've worked with these COVID patients for a year now, and I see what a lot of them have to go through, this is nothing.
Correct.
Nothing.
Correct. I've been in the ER seeing patients. Unfortunately, this now is the worst for what we're seeing in regards to numbers of patients. We're seeing sicker patients, and so I'm glad this vaccine is out. And I know that we're lucky that we were able to receive it. I know that yesterday the governor spoke as far in regards to the rollout of this virus and the rollout of this vaccine and the different phases. And I know on the mass.gov website and also on the Sandwich Town website, there are going to be references as far as when you can receive your vaccine, and you can go to those websites and find out what phase you would be in. But I again definitely recommend it. You mentioned that they kept you for about 15-30 minutes afterwards.
Yeah, half hour after.
Which is important because one side effect I didn't mention is just like with other vaccines, you can have an allergic reaction. They found with this vaccine, those who've had severe allergic reactions in the past. So for instance, if you've had an allergic reaction called anaphylaxis, where you've required epinephrine or going to the hospital because of that severe allergic reaction, it's advised not to receive this vaccine. So anyone who receives this vaccine will be observed for 15-30 minutes, and there'll be available medications in case there's an allergic reaction. But again, it's very few and far between, and we see them with other vaccines, and it's definitely nothing that I would avoid getting a vaccine. No issue I would avoid getting the vaccine for.
Yeah, and because both of us have received the vaccine, we're really interested in vaccinating as many people as we can, as quickly as we can. So we are hopefully starting next week, as everyone knows, with the first responders. But our goal is to move on quickly to the next tier, and so on and so forth. Both of us agreed that the vaccine is a very good thing, and neither one of us suffered anything from receiving either vaccine, the Pfizer or the Moderna vaccine. So we're hoping that all of you agree that you want to get the vaccine, and pay attention to the website. You can also call if necessary, and we will help you get set up when your tier time comes. Please don't call ahead of time because we're busy starting to vaccinate first responders.
And these vaccines, as far as the effectiveness, they're very effective. The science is out there, the data is out there in regards to the studies that were done on both the Moderna and the Pfizer mRNA vaccines. The Moderna is 94% effective, and then the Pfizer is 95% effective. So these are very effective in regards to minimizing any infection from COVID-19, specifically symptomatic infection. That's what they looked at. They looked at patients who received the vaccine and if they experienced symptoms of COVID-19. And I believe in both studies, there's combined 70,000 patients that were involved. And half received, in both of those studies, half received the placebo, half received the vaccine. And in the group that received the vaccine, there were very few numbers of patients that had any symptomatic COVID-19. And there was only one in both of those studies that actually had more significant symptoms from COVID-19. So it's highly effective, and I highly recommend getting it. Yeah, I mean it's a great opportunity for us to be able to have this vaccine roll out so quickly, and again, it's it is a very safe vaccine, and I highly recommend it. And I know one question people may have is, after you receive the vaccine, do you have to mask? What's going to happen after you receive the vaccine? Well, Joanne and I are 6 feet apart because you can still acquire COVID-19 if you've had the vaccine. You can still be a carrier. That's essentially the risk. So you can still be a carrier, you can still pass it along. So until this pandemic is controlled well enough, we're going to continue to wear masks. People who receive the vaccine are going to continue to wear masks because you can still spread the virus even if you've had the vaccine. It pretty much just makes sure that if you did come in contact with COVID-19, you most likely will have no symptoms or very minimal symptoms at that.
And also I want to mention that I think I spoke that I had an app on my phone for this study, and I have to answer questions like every week for the next 2 years. But we are also going to have something called vSafe that people can sign up for, and I hope you do, that CDC will then be texting you asking for information about side effects and whatever. So you also can participate in another type of study. The other thing I wanted to say is this article for my vaccine that I received, it was in the New England Journal December 30th, and it does tell about the efficacy and safety of the mRNA vaccines. And so it's interesting.
Yeah, the data's out there. I have the research summary for both the Pfizer and the Moderna vaccine. And there are other vaccines coming out there that are, it's a different science. It's not mRNA, it's adenovirus. But that might be a discussion for another day. I hope this information reassures you that the vaccine is safe, and that I am in agreement with the governor, with everyone who sees these patients and understands this pandemic, that this vaccine can definitely save lives, and is a major step in controlling this pandemic and getting us back to a normal world.